Yeah, I was a little rough on Praxis Prepper last time, but I actually wanted to be rougher on him. I actually want to beat him with a stick until he gets some sense. But rather than do that, which would probably be more satisfying emotionally, what I'm going to do is I'm going to put a bunch of graphs from the United Kingdom, and I'm going to explain to you who is actually at risk from COVID-19 disease in July 2021, and which parts of those risk factors Praxis Prepper has. So hopefully he will smarten up and actually look at getting Pfizer vaccination for him and his family, because hopefully if he delays, he might be okay. If he isn't okay, I feel bad.
You know, like I said, it's, my take on the vaccine since the beginning is like, well, let's wait and see. You know, we don't know how effective this thing's going to be. And the data, at least in its relation to the current set of, I think that this is a lot of the Pfizer and the Moderna vaccines, it looks like, you know, they're already starting to not be very effective.
As I said, it's not about personal risk, it's about personal risk and infecting others. But let's look at personal risk, and let's look at the risk factors that cause COVID-19 hospitalizations and death in the United Kingdom, where they've had a lot of experience with this. And let's explain the ones that actually affect Praxis Prepper directly, and why his decision not to be vaccinated with Pfizer or a similar type of vaccine actually is not a smart response. It is not mitigation, it is not science-based, and it's certainly putting him and his family at risk. Chances are, 1 in about 200, he's gambling and going to lose. If he takes the vaccine, the chance of getting a side effect is probably about 1 in 10,000 to 1 in 20,000. You figure the odds. The United Kingdom has almost 99% of the COVID-19 is now Delta. And people are flying in and flying out all the time because airlines never really stopped. And they're certainly expanding again, aren't they? In Canada, we've said we're not opening the borders for at least a few more months. That seems to be a smart decision to me. We can deal with this. We can support the economy affected by these decisions for a bit longer. It's been a long, long COVID haul. It's a pandemic, 1 in 100-year pandemic. Like climate change, right? 1 in 100-year flood, and next year, and then next year. So in historic and world terms, COVID-19 disease has been a minor global pandemic. It hasn't really killed as many people as it could have, or a different type of virus or bacteria or prion could kill. So what's the big rush? What's the big panic? Well, there's over 4 million dead, and it's probably a lot higher than that globally. And as you can see, we've nearly 8 billion people in the world. Given the fact you need 2 doses for most of them, we haven't got anywhere near the majority of the population vaccinated. You can also see in global terms that we have had 1, 2, 3, 4 spikes, 4 waves if you like, with the 3rd and 4th waves being calamitous. We are looking like we're about to hit a 5th global wave. Now if we look at daily deaths on a global scale, this is still a major problem. You can also see though that vaccinations are helping. We're getting a lot more people vaccinated. But if you didn't realise it, Praxis Prepper is an American. And America is an exceptional country. Most of the world doesn't exist for most Americans. America is it. America also has not achieved decent vaccination. You have to get about 75 to 85% of the population fully vaccinated, which in our case means 2 jabs. So America's a long way down from that one. But on top of that, there's something even more concerning. As you can see, over 600,000 Americans to this point have died. They weren't all in nursing homes, and they weren't all senile, and they weren't all very fat with diabetes. It's a significant killer, one of the major killers of humanity that we have seen come in a short period of time from infection. Worse than any flu we've had in the modern era, and pretty bad. But cases, infections and deaths, what's going on with them right now for Praxis to think about? Well, America has had 1, 2, 3, 4 waves. There's a suggestion that their 5th wave, like the global 5th wave, is starting. If you look at how many people have actually died from it, they lost a ton of people in 3 waves, mostly in the 3rd wave. But what's been going on? They didn't really lose that many in the 4th wave, and that's pretty good. That's a good sign. People can get infected, but if they don't get hospitalised and they don't die, really, who cares? And that's my message here. If you're not going to die or get hospitalised, who cares? Why are we shutting the economy down? Why are we doing X, Y and Z? But you can also see from this that right now they've stabilised at a fair number of deaths per day, despite the fact they've had vaccination occurring. Now if you look at their vaccination curve compared to the global vaccination curve, you'll quite clearly see that they're actually tailing off the number of people that are being vaccinated. They've hit most people who will be vaccinated, and they're now failing from that. So let's look at the actual individual risk factors from the United Kingdom data that suggests that you can be hospitalised or die from COVID-19, because there's a lot of 40-year-old males out there with beards or partial beards who think they're immune and they won't die. This is the immortality myth that people get. I feel strong, it can't touch me, I have a good immune system, I'm in a forest, I wear a mask some of the time, I'm not going to catch this disease. And if you look at Spanish flu in 1918, definitely a lot of rural areas thought that, but the rural areas that didn't actually completely lock down had devastating deaths. So being rural or being urban in an airborne pandemic merely delays when it arrives. It doesn't prevent it arriving unless you completely lock down, which nobody is doing because I know they're not. So Britain's very highly vaccinated compared to America and Canada, and Britain is seeing significant deaths. That is significant, pretty much day in, day out for the last 4 or 5 days, and they're kind of stabilising at about 35,000 new cases a day. Their own science people believe they'll have 100,000 cases by the end of July. New cases. Now if all of those cases are people who've been found to be infected from testing who are fully vaccinated, the chance of the death rate and the hospitalisation rate getting serious is pretty small, honestly pretty small. But if the 30% of the population who are totally unvaccinated catch COVID-19, and let's face it, most of them believe they're immortal, and most of them aren't really social distancing because of things like soccer, there's absolute evidence from the previous infections from COVID-19 that England's looking at a massive death rate and hospitalisation rate over the next 2 to 5 weeks. So could America, so could Canada. The Delta variant is in America, so is the lambda variant. Now, quick bit on testing. As you can see, the United Kingdom's actually tested a whole bunch more people than recently, and as ex-President Trump so proudly said, the more people you test, the more cases you'll get. He, in a way, was right, but he's also wrong. People are getting tested for various reasons, but the fact is that testing does not alter death rate. You can test nobody, you'll have the same death rate. You can test everybody, you'll have the same death rate. Okay, Praxis, I'm going to guess that you are 44 years of age. That's my guess. I mean, you are fairly trim and you are fairly healthy, so you could even be 45 or 48. But what age group is getting COVID-19 in the United Kingdom right now? As you can see, it's significantly altering. People in the age group of under 60 are really catching this disease far higher than the over 60 group, which makes sense when you think that most of the over 60 group are vaccinated. So vaccination has prevented the illness occurring in the over 60-year-old age group, but lack of vaccination and the age groups beneath 60. Remember, everybody in England at this point has had the opportunity over the age of 40 to have at least one vaccination.
Our expectation remains that by July 19th, every adult will have had the chance to receive a first dose and 2/3 will have received their second dose.
Most of them have done that, but a significant number have not. What you'll see is the younger age groups are now really catching COVID-19. Okay, let's do the actual risk factors the United Kingdom's found from data analysis and statistics in the last month that actually predispose it to be at higher risk from COVID or at lower risk. And let's see which of these pertains to Praxis Prepper. Well, he's not plus 80, at least I don't think he is. He's probably not got an underlying chronic disease, at least I don't think he has. But bear in mind, only 21% of the deaths did have an underlying disease in the United Kingdom. That's one of the big myths. I'm fit and well, I don't have diabetes, I'm not fat, I'm safe. No, you're not. You're at higher risk with those diseases, you're at higher risk the older you are. It doesn't mean if you're 20 and fit, you're safe. You're much less likely to be hospitalised, you're much less likely to die. But the risk is real. Back in February or March of 2020, when Praxis looked at the issue and then studied it over the next few months, as much same as I did, and a lot of people did, he came to the conclusion that it was not safe to take an untested vaccine compared to his risk from the disease. I'd like to point out to him that recent research is showing quite clearly that he's now 85% more likely to be infected and suffer hospitalisation than he was back when it was just the Alpha variant. The Delta variant is much more of a threat to him, and so that should have rebalanced his calculations of his personal risk. Now, I don't think he's under 40, but the under 40s are 70 times less likely to have an adverse reaction from COVID-19 than the elderly. And that's really important. That's why we need to make sure that the young people are vaccinated so they don't catch the infection and spread it to unvaccinated elderly. And actually vaccinated elderly are much more likely to catch COVID-19 despite having 1 or 2 vaccines than the younger age group. Their immune systems are not as good. Praxis has a young child. The young child is at very low risk of catching COVID-19 or having adverse reactions compared to Praxis. But the risk is real. It's a tiny risk compared to the adult risk, but the risk is real. We have seen numerous cases, hundreds of cases in North America, of children dying or being seriously injured on an ongoing basis from catching COVID-19. Makes sense. If you're vaccinated, you're less likely to catch it and have symptoms and spread it to your own children. Much less likely. Now, I don't think Praxis is pregnant, at least he doesn't look it in the videos, but I would say if he identifies as a woman and decides to get pregnant, he puts himself at huge risk. Being a bit facetious there. But I said early on in 2020, try and delay pregnancy if you can. I'm still sticking to that. We have seen at Canada's largest maternity hospital, which is part of the hospital I work at for a little while longer, we have seen definitively high levels of COVID in pregnant women, higher than the community, and we've seen much more adverse reactions. So Praxis, again, if you're vaccinated, you're much less likely to infect somebody who might infect somebody who's pregnant. It's called doing for others rather than just thinking of self, which I know you haven't been doing, and I've been a bit rough on you, but you got me going. Now, I don't know if Praxis is over 50 now. I suspect he is not, but I suspect he's getting close to it. He's got the old grey hairs showing, as have I, and Kitty did my hair today. I am 57. I take this quite seriously. When they tell me, when the science data analysis tells me I'm at high risk of acute illness, I may not die because I'm not over 70 or 80, but I could die, but I'm much more likely to be hospitalized, I'm much more likely to need BiPAP, I'm much more likely to need ventilation, I'm much more likely to need inotropes, I'm much more likely to have long COVID. I take that seriously, and if I can take a vaccine that reduces the chance of that happening dramatically, I'm not sure why I wouldn't. Nobody quite sure why, but men actually have double the chance of dying at working age than women. Nobody's really sure why, and that's kind of an interesting fact. Again, being male, you need to take that on board. It doesn't mean there's no risk for women, but it does mean that the risk of being a man and catching COVID and having a much worse outcome is higher for me than Kitty, who's also 57. However, working age women are more likely to catch COVID-19 and therefore infect the males in their lives who are more likely to have a worse outcome. So I don't know much about Praxis' romantic life, but if he's interested in women, that's also something he should bear in mind. They're more likely to catch it, they're more likely to give it to him, and he's more likely to die from it. However, women are more likely to die from COVID-19 once they get elderly, and they've adjusted this for actual numbers in the population. It's not just because there's way more women over the age of 80. This is going to shock people, they actually look at variables that they can control for, like the percentage in the population and who lives where and how many people have had which types of vaccine. They look at all of the factors. This isn't just something they make up, it's not just something they shove together in half an hour in a Zoom meeting. This is data analysis scientists, epidemiologists with PhDs looking at the issue, and almost all of them, apart from a few crazy people that were cited in Praxis' comment section, absolutely will tell you, get vaccinated. They're not going to tell you, wait, they're going to say, get it now. This is kind of an interesting one. Vaccination's higher in whites than it is in black and yellow and green people. But the bottom line is also, when you adjust for all of that, and you adjust for income, and you adjust for geography, and you adjust for everything, actually being a racial minority appears to be much more of a risk factor than not. Now, I'm fairly sure that he's from European stock, but you know, a lot of white Americans actually do have black genetic material in them because of their ancestors' rape and pillage and relationships in the past. So that's something you might want to think about. He may not look or identify as black, but he may have black genetic material, which might make him more likely to have an adverse reaction from COVID-19. There you have it. I love you, Praxis, and I wish you well. What you're getting in consistently on the mainstream is COVID's over, it's fine, we're safe. That's what I'm hearing in Canada over and over and over. In fact, today we had the lowest number of cases in Canada we've had for almost a year, and everybody's like really happy, and we're opening up a week early, and that's great. The problem is that the Delta and lambda variants are in our communities, and it takes a few weeks. Sometimes I've noticed COVID's a weird disease. Sometimes it'll take even 3 months of community circulation before you get significant illness, significant hospitalizations and significant death. Simply put on the vaccine as an armour. It will reduce your chance of catching this disease or having a problem with the disease dramatically. It will make it much less likely that you'll infect people you love and care about, and it makes it much less likely they'll infect you. Absolutely, there's very few side effects from any of these vaccines. The ones like AstraZeneca and Johnson and Moderna that have been fingered have either been removed for certain target groups or altered. Yes, there's some people die from blood clots, blah blah blah. Every vaccine that's ever been, every medication, including aspirin and Tylenol that's ever been used, has side effects and kills some people that take it. But to say, I'm not taking it, I feel safe, I'm in a forest and I wear a mask when I go shopping, and I know he wears N95s because he is smart. He needs to take on board the fact that they are not a guarantee about not getting infected. If he's been vaccinated and he continues to use distancing and N95s and lives in the forest, his chance of catching COVID is really tiny. And if he actually catches it, his chance of having an adverse reaction from it is little to none, specifically because of his age group and the precautions he's taken. It's not something we should mess around with. This isn't something you have to be frightened of. mRNA vaccines have actually been well studied, and it's a massive breakthrough in our armour specifically against coronaviruses amongst others. This could actually impact cancer deaths over time. The kickstart happened because millions of people were getting infected by an airborne virus, and the data looked like we would have 2.2 million dead in America. And I would argue, without vaccination and all the distancing that we've done and masking that most people are doing, yeah, I think 2.2 million was a good call, a number of people that were going to die in the States. And most of them would have been over the age of 60, not all of them. A significant number, 100, 200,000, would have been under the age of 40 and physically well. That is why you need to get vaccinated. This isn't over, not going to be over for a long time. Vaccines will become less efficient as viruses learn to get around them. 88% efficiency over a year from 94% efficiency, that's pretty good going. The more that are vaccinated, the less viruses can circulate, the less chance the virus has of mutating. So actually think about what you're doing, think about where your source of information are coming from. Tools. This has been a 2021 Wolfie Terrier production in the sun.